My name is Evelyn Opundu. I work for the International Center for Research on Women as the Africa Director. Today, we convened an evidence dialogue because ICRW undertook a study where we spoke to practitioners in sexual reproductive health rights and policymakers in order for us to understand what the evidence gaps are. What are the questions? What are the outstanding evidence? What is the outstanding evidence on sexual reproductive health rights? And what do practitioners need in order for them to work towards advancing sexual reproductive health rights? What came out strongly is that there are some persistent issues that we have had on the table over a long period of time, such as the high numbers of maternal deaths and disabilities that are related to maternal health. There are also issues such as unsafe abortion. There are issues such as early child marriages. Those are issues that have been there over a period of time. But there are also new and emerging issues that we have not had sufficient data or evidence to support development of policies or interventions. And some of these are, for example, access to sexual reproductive health rights and rights for older adults, women in menopause and even men in andropause. We've also seen, with the emergence of technology and how a lot of people are now using technology. But technology, while it is good, has also been used to facilitate technology-based, gender-based violence. We've seen a lot of misinformation and disinformation that is related to sexual reproductive health, even products that have been advertised online that are harmful to women's health and are unregulated. And so we are saying it's important for us, not just as Kenyans, but also in Africa, to set the agenda for the research, for the studies that are done in Kenya, and that those studies, the research, has to be done from a very context-specific manner with the sensitivities, whether it comes to culture or the manner in which the research is done. And that's why for us as ICRW, it was important that as Africans that are working with the lived realities of Africans, we go out to the communities, we speak to the women, we speak to people who are advocating for these rights, as well as policymakers and the academia, to understand what is the missing evidence, what sort of evidence would they want us and the others in the sector to generate to support the advancement of sexual reproductive health and rights.